Hey guys, thanks for joining me again for another episode of my YouTube channel, Long Live the Brains. Don't forget to subscribe to the YouTube channel, drop some comments, drop some questions. You guys have been great about reaching out to me and asked some really great questions that I've had to go look up things to be able to answer. It's going to be a guide for these videos, will continue to be a guide for these videos, so I hope that you'll continue to interact with me so that these can really be a resource for you. It's the holiday season, and many of you will be around friends, family, loved ones that you may not normally be around, and so maybe some of these issues will pop up in conversation, and you might find someone who could also use these videos as a resource. So don't hesitate to tell them about the videos. The more people that know about these conditions, these diseases, the better. We need to raise awareness, and education is the way to do that. So also, Christmas is this week, and it's a time where we enjoy being with loved ones, and we also remember the loved ones that are no longer with us. And so I thought it was an appropriate time to discuss Parkinson's disease. So what's the relationship there? Well, my grandfather, who is deceased, had Parkinson's disease. And so I want to talk a little bit about that disease. Now, we've talked about Parkinsonism. That's a constellation of symptoms. And I said that Parkinson's disease is one of the causes of Parkinsonism, but there are many things that can cause Parkinsonism. So Parkinson's disease is a neurodegenerative disease, meaning the neurons or the brain cells are dying, they're degenerating. And neurodegenerative diseases can manifest in a whole host of symptoms depending on which neurons in different areas of the brain are dying off. So Parkinson's disease currently affects over 1 million Americans. Every year, about 60,000 people are diagnosed with Parkinson's disease. The patients are dealing with bradykinesia, or slowness of movement, rigidity, which is kind of a muscle stiffness. They can have the resting tremor, and they can also have postural instability. They can have issues with walking. There's a entity known as freezing of gait, or fog, which can also occur in patients with Parkinson's disease. Now, I mentioned that it's a neurodegenerative disease, so I want to dig into what's going on in Parkinson's disease. So I'm going to show you, hopefully you can see this. We'll throw this up in a bigger, higher quality slide as well. But this is a slide that sort of depicts what's going on in Parkinson's disease. So this image in the lower portion is a cross section through the brain. Okay, it's just an illustration. But you'll notice that the area that's in color, this is an area in the brain called the midbrain. It's part of the brain stem. And we can see a dark area. Here's a larger cross section of it. There's a dark area. We can see that when we look at brain specimens not even under the microscope. We can just look at them. Now, that dark area is a region of the brain called the substantia nigra. Now, these cells are very important because they produce dopamine, okay? Now, we said that Parkinsonism, or Parkinson's disease in this case, is a neurodegenerative disease where the dopaminergic, or cells that produce dopamine, cells are degenerated. And we can actually see that when we look at the brains of people with Parkinson's disease. And we have an example here. So up at the top, we have a normal brain that doesn't have any evidence of disease, and you can see the dark substantia nigra on both sides. But if you look at the brain of a person with Parkinson's disease, that dark area is no longer as dark, and that's the evidence of neurodegeneration. So the cells that produce dopamine are dying, which means our amount of dopamine is less. Parkinson's disease is a state of dopamine deficiency. That's why we use levodopa, which is metabolized into dopamine. So we're trying to supplement that dopamine that's just not there in Parkinson's disease. And that's why levodopa is such a successful treatment for Parkinson's disease.